Hello, my name is Jalen Podolak, and this is my Educated Citizen Capstone Presentation. I chose the issue of infant formula shortage. Why this matters is because infant formula is essential for many infants. It's critical for premature or medically complex babies. The shortage can increase the risk of malnutrition, and it also creates an emotional, financial, and logistical stress. The 2022-2023 infant formula shortage in the United States exposed weaknesses in the nation's supply chain and healthcare system. The shortage stemmed from multiple factors, including pandemic-related disruptions, manufacturing limitations, and a major recall by Abbott Nutrition. This crisis disproportionately impacted families with low incomes, infants with specialized dietary needs, and those living in rural areas. In Nebraska, families participating in the WIC program were particularly affected due to restriction on approved formula brands and limited access at local retailers. As far as resources, the FDA regulates infant formula safety and limits the number of manufacturers. Emergency imports and regulatory flexibility was used during the shortage, according to the FDA in 2022. Temporary brand substitutions were allowed during the shortage, according to the USDA in 2022. The Douglas County Health Department also provided education on formula feedings and alternatives. The One World Community Health Center supports the WIC enrollment as well. As far as strategies, one was called Expanding the WIC Flexibility. The USDA had nationwide waivers that allowed states to expand approved formula brands. Nebraska could revise WIC contracts to allow multiple formula brands. DHHS could also implement automatic emergency flexibility during the shortage. Funding was primarily through federal USDA WIC funding. The second strategy was called Operation Fly Formula. This was under the Biden administration and was launched in 2022 to address severe formula shortages in the U.S., according to HHS in 2022. It imported formula from international manufacturers that meets U.S. safety standards. It included specialty formula for infants with medical needs as well. They delivered thousands of pounds of formula from countries like Germany and the UK. But there were high transportation and logistics costs. It was primarily funded through federal emergency aid. Why I chose this issue is because it highlights the critical role nurses and healthcare providers play in advocating for vulnerable populations. The shortage demonstrates how systemic issues can directly affect patient health and well-being. It emphasized the need for equitable care and effective communication. As a nursing student, and as somebody with a young niece who is on infant formula, I feel a strong connection to this issue because I understand the stress caregivers face when essential medical nutritional needs are disrupted. I want to be equipped to support families in times of crisis by providing education, advocacy, and access to resources. For my effective communicator, during one of my clinical rotations, I cared for a patient with a tracheostomy who was ventilator dependent and unable to speak. He could only communicate by lip reading and mouthing words. At first, I struggled to understand him. On this shift, my assigned nurse was managing multiple patients and sometimes seemed overwhelmed and frustrated, which caused the patient to shut down. I spoke with my nurse privately, suggested we give him time and space to communicate in his own way. While it was uncomfortable to approach an experienced nurse, I advocated for the patient professionally and compassionately. I focused on giving the patient adequate time to mouth his thoughts, using therapeutic communication and offering supportive words. By the end of the shift, the patient appeared more positive, and my nurse acknowledged my suggestion. I learned that effective communication in nursing extends beyond spoken words. It involves patience, active listening, nonverbal strategies, and advocacy. Speaking up, even in high-pressure environments, can ensure patients feel heard and respected. This experience informs my approach to families affected by the formula shortage. Clear, compassionate communication is essential to help caregivers navigate stress and make informed decisions regarding alternative feeding options or community resources. My second effective communicator. While caring for a patient who made rude comments to my nurse and myself, specifically how we were treating her and her care, I chose to remain calm, professional, and empathetic. I remained respectful while using verbal and nonverbal communication, avoiding defensive reactions. Over time, the patient softened, and by the end of the shift, she expressed gratitude for my kindness and empathy. I learned that remaining composed and empathetic can transform difficult interactions into meaningful connections, building trust and promoting patient-centered care. I also learned that self-reflection and awareness of my personal strengths, such as patience and kindness, are essential in becoming a skilled communicator. In the context of infant formula shortage, caregivers may feel frustrated or overwhelmed. By maintaining patience and empathy, I can foster trust and provide accurate guidance about formula alternatives, WIC resources, and safe feeding practices. For my reflective individual, during a clinical, I cared for a patient with Down syndrome and was nonverbal. I had limited prior experience with this population, so I shared my knowledge gaps with my assigned nurse and sought guidance. The patient's mother provided critical insight on communication cues, routines, and community resources as well, like Down Syndrome Alliance. I closely observed nonverbal signals and adapted my interactions accordingly. I realized the importance of acknowledging my limitations, seeking guidance, and observing carefully to provide individualized care. Reflection helped me recognize assumptions based on unfamiliarity rather than the patient's actual abilities. By involving the family and considering support systems, I enhanced my understanding of holistic patient-centered care. This experience strengthened my confidence in providing inclusive care for patients with intellectual or developmental disabilities. Reflection is crucial when supporting families affected by the formula shortage. Understanding their concerns, actively listening, and evaluating resources that interventions are both appropriate and effective. For my second reflective individual, on a medical surgical unit, I witnessed a physician deliver a cancer diagnosis to a patient quickly and without allowing sufficient time for processing. The patient appeared overwhelmed and distressed, and she was all alone, so I stayed with them. I was able to provide emotional support and using therapeutic communication to help her express her fears. During this time, the patient shared that she had recently lost her sense of taste due to a stroke, which was affecting her nutrition. I relayed this information to her primary nurse and care team because they were constantly and continuously asking her why she was not eating and had no strength. This experience taught me that being reflective involves emotional presence and attention to patient cues. I learned that advocacy is not limited to medical interventions. It also includes addressing emotional and holistic needs. By reflecting on the patient's experience, I understood how small actions, such as active listening and compassionate presence, can significantly influence patient well-being and care. Similarly, understanding caregiver experiences during the formula shortage requires reflection and active listening. Identifying barriers families face allows for more personalized guidance and support. For my change agent, during a clinical rotation, I cared for a Hispanic patient who primarily spoke Spanish. Initially, I made assumptions based on her cultural background, but I consciously adjusted my approach to learn more about her values, priorities, and family involvement. I researched healthcare disparities in the Latino population to inform my care. I learned that being a change agent involves recognizing personal biases and actively addressing them to provide equitable and culturally responsive care. Engaging patients as individuals rather than making assumptions based on ethnicity or gender is critical for advocacy and social justice in healthcare. Small, intentional actions can create meaningful change in patient care experiences. Addressing the formula shortage requires cultural competence. Families from diverse backgrounds may have unique concerns or barriers. Awareness and active efforts to understand these needs help ensure equitable access to information and resources. For my second change agent, while working as a pharmacy technician, I identified a medication bottle that had been incorrectly labeled when returned to stock. Recognizing the potential safety risk, I investigated the discrepancy, verified the issue, and informed the pharmacist. After they performed their own investigation, it was revealed that no prescriptions were affected by this. The pharmacist later held a meeting with the staff to reinforce proper labeling procedures. I learned that being a change agent can involve attention to detail and proactive problem solving. Small actions, like noticing discrepancies and addressing them, prevents harm and improves patient safety. This experience emphasized my responsibility to advocate for patient safety and uphold professional standards in healthcare settings. In the context of infant formula shortage, similar principles apply. Small errors or oversights like miscommunication about available formula and incorrect stock information can have significant consequences for infants' health. By double-checking information and addressing discrepancies immediately, I can help ensure families receive accurate guidance and resources. This mindset reinforces the value of creating safe, reliable systems. Excuse me. And it also highlights how small, deliberate actions at the individual level can prevent harm and improve outcomes. Across all experiences I have developed as an effective communicator, reflective individual, and change agent. I have learned to advocate for patients, communicate with empathy, reflect on assumptions, and take initiative to improve care. From supporting patients with communication barriers to ensuring safety in medication administration, each experience demonstrates how small, intentional actions can create meaningful change. The infant formula shortage serves as a broader reminder to the systemic issues that impacts patients and families, and underscores the need for advocacy, equity, and adaptability in nursing practice. Moving forward, I am committed to integrating these lessons into my nursing career, ensuring that every patient feels heard, respected, and supported. By reflecting, advocating, and communicating with intention, I strive to continue to grow as an educated citizen and change agent in healthcare. Thank you.